boy. Good evening. How are you? Welcome back. Thank you for being here with me with another I Care for Your Brain. This is where I try to give you very high quality science-based information about the brain so you can feel educated and empowered and make the very most out of your recovery. So tonight we'll be talking about the unbelievable importance of sleep after any brain injury. So sometimes when I'm here I talk with you about stroke, sometimes I talk about Parkinson's, sometimes I talk about traumatic brain injury. And the truth is that even though these are different mechanisms of action to injure the brain, there's many things that are common in terms of symptoms and managing symptoms, no matter what the cause of the brain injury was. So even though I'm taking a lot of this information tonight from the For Your Brain Stroke Recovery Guide that we have recently put out, it really does apply to any of you out there. So this relates to traumatic brain injury from being hit with something, brain injuries from not enough oxygen to your brain over time, brain tumor, stroke, different types of degenerative diseases. There's many different things that can cause sleep problems. So it really applies to many of you listening tonight. Sleep and prioritizing sleep is the number 5 rule of rehab in our recovery guide, and it is so important that we really wanted to emphasize it tonight on the Facebook show, so as many people would from it as possible. So it really goes without saying that, hey Jerry, it really goes without saying that sleep is a staple of physical, mental, and brain health. We used to not know actually why we slept. It was a time that the body and the brain could really go into a deep state of rest. But what we now understand is that the body and the brain is actually in some ways more active during sleep, particularly deep sleep, than it is even when we are consciously awake. And now we really subscribe to the idea of the restorative hypothesis of sleep, that while we're sleeping, our brain and our body is going into super repair mode. It is helping us make new memories. It's helping us with emotional processing. And for the purposes of our talk tonight, it's really cleaning out stuff that needs to go after a brain injury. A brain injury is essentially the loss of some or many neurons, brain cells. And after brain cells die from lack of oxygen, from damage, there is a bit of garbage that's left behind. The contents of cells spill out and they have to be chopped up and removed. And so we know that this is one of the functions of REM sleep. So I'm really excited to talk with you all tonight about this issue. So if we just take stroke, okay, we know that more than half of people after a stroke have new sleep problems. So this is typically feeling too sleepy during the day. So this is something that across all brain injuries. So we call this hypersomnia, and this relates to that neurofatigue that we've talked about before. People can also have insomnia. So what this is actually trouble. There's two kinds: trouble falling asleep or trouble staying asleep. Many people after a stroke, or a TBI for that matter, have disordered breathing when they sleep. This is something like sleep apnea. We also know that people can develop restless leg syndrome or circadian rhythm disorders, where you get your days and your nights all mixed up. So no matter what the cause of the sleep problem, the end result is that the person is not getting long periods of continuous sleep. That is the key word for our discussion. Brain health requires continuous sleep. So why is sleep sacrificed after a brain injury? Well, there's actually 3 big reasons and a couple smaller reasons. The first one is that there can be changes in the parts of the brain that are very much responsible for sleep. So we think of these as the brain stem, the thalamus, and really the whole right hemisphere has been implicated in sleep. So if your specific TBI or stroke was in those areas, we would predict, based on the research, that you actually are going to be more likely to have sleep problems. So depending on where exactly the injury in your brain has happened. The second reason is that our brain has to work incredibly hard when there is a focal injury to process life and get through the day. And so the brain is literally more tired. And you all know this, who live with a brain there, in terms of how quickly you can become fatigued and how overwhelming things can become. The hyperstimulation of audition, hearing things, seeing things, smells, stress. The brain becomes incredibly sensitive after an injury, and very often it takes a lot of cellular mental energy to process anything at all. So just think of it like the brain is now running a long distance sprint as opposed to being able to run fast for a little while and then recover. Number 3 reason is that the brain's immune system is working very, very hard to get all of the stuff in the brain out that it doesn't need anymore, that kind of garbage, the remnants that we were talking about before, because it really wants to have the soil cleaned out, fertilized, so it can plant the new seeds of new brain cells and new branches on existing brain cells so it can recover. Desperately wants to return to homeostasis, to get better, to clear out the bad stuff, to make way for the good stuff. So in our brain's immune system, which the brain has its own immune system, we know that in deep sleep, that is the job of the brain, is a clearing out. And I want to talk a little bit more about that later. The other things are new medications after a brain injury, or all of a sudden in the hospital, perhaps they stopped a medication. I see that very often as a clinical neuropsychologist, that someone's antidepressant that they were taking forever, sometimes a sleep medication that they were taking forever. Their job in the hospital is to medically stabilize you. And sometimes if they think a certain medication was maybe throwing off your brain chemistry, part of what they do is they cold turkey stop you. Well, that can affect your sleep. We also know people out of the hospital or rehab that the funny exposure to sunlight that happens in an institution also has some long-term effects. So if you were in ICU for a relatively long time, if you were in a hospital or rehab, you are off kilter with the natural falling of the sun, and we are based on a circadian rhythm. Our wakefulness and our sleepfulness are a balance between exposure to sunlight, melatonin going up and down, and stress hormones going up and down. So if that gets all thrown out of whack, then you're going to have a problem. A big one for many of us is stress, anxiety, trouble relaxing into sleep. Sleep is not something that you can directly make happen, right? You have to kind of succumb to sleep. You have to kind of relax into it and invite it in. So it takes a certain amount of the central nervous system to calm down in order to put down your dukes and let sleep kind of take you in. So many people after a brain injury have significant stress and anxiety. They've just recently been through a very traumatic event. So you literally have stress hormones pumping through your body. And as you know, I feel really strongly that part of stress after any type of brain injury is a lack of education and a lack of support. And I really see those two things as within our power to change. Those feel like very unnecessary levels of disability. That's really why I'm here with you weekly, trying to give you this neuropsychological information, because I think just access to information alone and feeling like you can understand what's happening to you and your brain is a form of healing. So why do these sleep problems matter? Well, we know even after one night of poor sleep, your mood is absolutely affected. And I wonder what you all would say. What is the mood that you can find yourself in after a bad night of sleep? Well, you might have guessed it, it is irritability. That is the number one thing that happens. We become short, we're overwhelmed. Well, guess what? If you have a brain injury of any kind, you already live in that space very frequently, where just something that somebody with a healthy brain might not even comprehend. Like I said, the music, a loud smell, stress, conflict, these things, my understanding is that they are very, very overwhelming. And so they're only going to be more overwhelming if you don't have good sleep. In terms of a stroke, Sleep problems that go untreated actually predispose you to having another stroke, okay? So I'm not trying to scare you, but I do want you to know what's on the line here. We know that when people don't sleep well, and due to certain types of sleep disorders, it can affect your blood pressure, it can strain your heart. We also know cognitively, if you're not sleeping well, it can make it hard to concentrate. Sleep and memory go hand in hand. I'm going to tell you about that in a little bit. We know it can increase your risk of having a traumatic fall in the night. If you've already had a brain injury of any kind or a stroke, you don't need another one, okay? So if you try to get up and go to the bathroom in the middle of the night and you're sleepy, that's a recipe for disaster. And it actually increases your risk of dying, of decreased mortality. So if those things don't compel you to want to listen more and figure out what to do, I don't know what to tell you. But at the end of the day, what I think you really care about is knowing that untreated sleep problems will 100% reduce your ability to recover after a brain injury. It's really that serious. And the number one thing that we think affects it is if we don't have that cleanup time in our brain. During those deep stages of sleep, like I said before, the cleanup crew in the brain basically gets called out to task, and it works so hard to flush the things out of your brain. This is incredibly important, especially if you have had blood in your brain, so any kind of a hemorrhagic issue. So the bad stuff has to get out or the rebuilding cannot happen, okay? Brain repair mechanisms are activated during deep sleep. Think about it like soil. We have to turn over the soil, get all the weeds out to be able to replant the growth of this next part of your brain's life, which is recovering from an injury. We also have a very intimate relationship with deep sleep and memory, okay? So like I said, the seeds of recovery get planted, but really the seeds of memory also get planted. And how the brain does this is absolutely fascinating. There are movies that get played in your brain over and over again during the night between your hippocampus, your memory centers, and your prefrontal cortex, where they are comparing notes of the day's events. Many things that have happened to you throughout the day are on a repetitive loop as you're sleeping, and the brain is desperately trying to figure out what are the important parts to keep. The real estate in the brain is prime. We cannot make a memory of every single thing we go through, or our heads would be ginormous, okay? So we have to prioritize, and what we really review is anything that had a threat to it, because the brain is ultimately governed by our genes, of course, and our genes have one goal in life, which is to live, to survive, to procreate. And so they are very concerned with threat detection. So think about it, after a brain injury, how many of you are processing an emotional trauma in addition to a physiological trauma? So you need sleep, not just to decide what to keep and to turn it into a long-term memory. You really also need sleep to be able to emotionally process what it is you've been through. So as we are going through that process of kind of pruning memories we don't need and deciding what it is we do, that learning process is called consolidation. That's when we're moving things from short-term memory into long-term memory. That very process is neuroplasticity. That is the growing of new branches on brain cells. That is the growing of new axons. That is the growing of new synapses. Deep sleep equals neuroplasticity. Following a deep sleep, many times, once you are aware of what you're doing during sleep, people talk about waking up with a sense of peace, a sense of resolution, an answer to a problem. That's where the term sleeping on it literally comes from. So part of the job of sleep is to figure out how the day's events, especially the traumatic things, fit in with our life story, okay? When people don't get good quality, continuous deep sleep, it really sets the stage for things like post-traumatic stress disorder. In fact, some researchers really feel that at the heart of PTSD is a sleep disorder. And when I have someone come to me, potentially like a returning military service person, I live in an area where we have a lot of military in North Carolina, there's oftentimes many problems, okay? This is a little bit of a tangent, but there's sleep issues, there's trauma, stress, family things, physical pain from everything they do, too much alcohol sometimes. And when everything is kind of a chaotic mess and there's so much going on with the person, we always start with sleep. If you don't have sleep on your side, all the efforts in the other departments are going to be a lot less powerful. So when emotional trauma goes unresolved, we are walking around with much higher levels of stress hormone. This is that cortisol, the adrenaline. This slows down recovery on the cellular physiological level. It also creates an internal distraction. Even if it's an unconscious processing, if there's something that is unresolved, if you haven't made peace with a certain situation, even the big question of why me? Why was I hit by the car? Why did I have this stroke? That is an unresolved issue that unconsciously really zaps the brain's cognitive resources. So many people come to my clinic and talk about, I cannot focus, I can't make new memories, and it comes back to a trauma issue because it's literally consuming us in the limited amount of space we have in our brain without us even realizing it. So think about it like this. Good sleep is free therapy. The sleep cycle forces us to identify the problem. There's an analytical process that happens where we're fitting it into our previous life history. We're trying to find the silver lining. We want to understand how to protect ourselves. And the brain's job is to present you with a solution. A lot of people think that's the function of dreams, is the experience of going through identifying the problem, analyzing the problem, and finding a solution. I keep saying this word continuous, and I really want you to understand what I mean by that. So when we sleep, we have 5 stages of sleep, which of course go from very light sleep into a little bit more of a deeper sleep, and then we have very deep sleep and REM sleep. The important thing to know about sleep is you can't pick and choose. You cannot wake up in deep sleep, go back to bed, and resume deep sleep. It always resets its clock to stage 1. And with many sleep disorders, the issue is that when we finally relax into stage 4 and 5, the deep sleep and REM, that's when things like sleep apnea can kick in. That's when things like nightmares can wake us up out of sleep. And we wake up and we cannot get back into that deep sleep. It has to start all over again. When you go from stages 1 to 2 to 3 to 4, it takes time. This is where the continuous word comes in. You can't just go 1 minute in stage 1 and within 5 minutes you're in REM sleep. It takes a relatively long time. It's different for everyone, but it is a process, and one is dependent upon the other. The thing you might be thinking to yourself, if you're someone who is listening with a brain injury, is, hey, lady, my problem is not that I keep waking up. My problem is that I can't get enough sleep. And that's really the topic of a previous lecture I did called neurofatigue. So if that's you, I'm going to talk about it a little bit now, but if that's you, please go to the YouTube page or back here on the Facebook archives and try to find that one, because it's a whole half hour just on neurofatigue. But what we do know is the big reason that too much sleep after any type of brain injury is detrimental is really 2 things. One is that it impairs recovery in that we're not spending as much time as we could in active rehabilitation. So we really care about this in inpatient rehab settings, and they literally won't let you stay if you're not able to do the 3 hours of rehab because you're too fatigued. Now, I don't think that's fair, but I understand that's the way the insurance business works. It also reduces our brain's ability to be stimulated and to be socially connected, because yes, we may be getting some benefits from the repair mechanisms, but we have to balance that with the hard, active work of therapy. The other thing is it really sets the stage for depression to be sleeping too much. You literally find yourself out of sync with the world and other people. So what is a healthy amount of sleep after a brain injury? It is definitely different for everyone, and there's some genetic studies that show that we are either good excretors of an interesting chemical that makes us feel sleepy, or we are not so good of an excretor. And so some people have more efficient sleep. So when they go to sleep, that cleaning out process can happen really quick. We know a lot of those people, right? They only need 5 to 6 hours of sleep. That is definitely not me. And there's other people who need a lot more sleep because for whatever reason, it just takes their brain longer to clear this stuff out. The goal is 8 to 9 hours of continuous sleep. Now, if you've had any kind of brain injury, even increasing that by an hour or two is fine. Naps are expected early on. They're actually okay, in my opinion, for a very long time. You just need to understand how to manipulate naps so it doesn't wind up messing with your nighttime sleep. So you want to try to stay awake after 3 p.m. and keep every nap to under an hour. It's actually very good for the brain's recovery after an intense therapy session, once you're done with the inpatient stuff, to have a little half-hour, 45-minute nap once you come home from PT or once you do some speech exercises. It literally helps the brain put it into long-term memory. So it's really as simple as this. Start reflecting on your sleep quality. How do you feel when you wake up in the morning? Do you feel rested, or do you feel like you could go back to sleep? If you feel like you could go back to sleep, you probably aren't getting good enough quality sleep, and you have to start to analyze your life and your circumstances to bring some information to your doctor. And that's what I want to talk to you about next. So the first thing I think of is how medications and stimulating foods we put into our body could be a part of it. So there actually are many medications that have stimulating qualities to them. So believe it or not, any kind of inhaler for asthma is one. There's a lot of over-the-counter decongestants and things for joint pain, like glucosamine. Those things have kind of a stimulating property. Sometimes there's even caffeine in them. There's things that we use for blood pressure, beta blockers, calcium channel blockers. These things can disrupt sleep in many people. So you could go through your medication list, try to see if you can cut out anything that has caffeine, and then bring the list to your doctor and see if they can help you identify something else. Medications and sleep is a very important topic, not only to think about how that might be perpetuating a sleep problem, but also please try very hard not to, if you can help it, treat your sleep problems with a prescription medication. There's a lot of data to suggest that we dramatically increase our fall risk when we use things like benzodiazepines, Xanax, Ativan, that kind of thing. There's more confusion long term. We think we increase our risk of developing dementia when we take them heavily over time. Things like Ambien can definitely cause confusion, trouble with falls. Anything with a PM at the end of the name, Tylenol PM, Advil PM. That PM is Benadryl, and Benadryl actually has a negative effect on memory in the brain. So once you kind of clear through the medication stuff, and you make those kind of the easiest things to get out of the way, is, okay, what exactly is going on with my sleep and what can I do about it? So the first thing we always advise here at I Care for Your Brain is to start monitoring the behavior you want to ultimately change. Just keep a sleep diary for 1 week where you track the time you go to bed, the time that you wake up, how many times you wake up, how do you feel after naps, what times are your naps happening, do you feel refreshed, are you still tired? If you have a sleep tracker, this is a really good use for it. Basically, graph it out, bring that information to your doctor. Doctors like data. They want to understand what the pattern is. There's something called sleep hygiene that, again, before you go do anything dramatic about your sleep, there's really 6 things you need to make sure that you're doing, according to the research. So I already told you one is avoiding late afternoon naps, right? The next one is sleeping and waking at the same time every day. That can be difficult, but keeping that time consistent has actually been shown to help regulate the sleep cycle and let us stay in sleep longer. Avoiding screens at least 2 hours before you go to bed, especially anything where the screen is exceedingly close to your face. So I'm looking at you, iPad and iPhone. Making sure you don't eat or watch television in bed has been proven to help people get a better night's sleep. If you do have trouble falling asleep, the idea is don't lay there for any longer than 20 to 30 minutes. Get up, try to keep the lighting low, and do something kind of boring and relaxing, like reading an actual book under low light, okay? The other thing is we want to try to get everything out of the bedroom that is non-essential. There's some research to suggest having a television in your bedroom is not a good idea. Many of us have exercise equipment in there that we're not exactly using. So if you do all 6 of those things and you still feel like you're having trouble, then you move into the next level of intervention. And what I would recommend is developing a sleep ritual about an hour before bed. This is basically where you prepare your brain from transitioning from being active and seeking stimulation to where you can actually get yourself in a more receptive state of mind, calming that central nervous system. So like I said, you can accept sleep. One of the big things that gets in the way of people relaxing is that we are very good avoiders during the day. We can do a lot to distract ourselves from our problems, our stress, the conflict in our relationships. But when our head hits that pillow, the problems come right back here. And we are exhausted at that point in the day. We are not good problem solvers. We are emotional. We are sensitive. It's the worst time ever to think about your stress. So we recommend worry journals for literally getting the worries outside your mind, putting them on paper on the side of the bed. You know that they're there. We encourage people to write action steps under the worry. So this is where you try to identify what is within your control. What can you do tomorrow that will actually work on resolving this problem? It's amazing how that can make you feel so much more empowered, because sometimes you come up with the reality that there's nothing that you can do. This is a powerless situation. Someone else is mad at you. They've misunderstood. The truth is, there's nothing you can do. This is the good old serenity prayer, right? Or you're asked to put an action step into place. Okay, well, I could check in with the person tomorrow and see if they meant that tone that they seemed to be giving me when I saw them at the supermarket, right? You can also do something like sleeping at night with your blinds open. This gets back to the sunlight thing, the melatonin thing. So reestablishing your circadian rhythm. It's also part of the avoiding screens for 2 hours before bed. You want to be in as much of a natural rhythm with the sun's rising and falling as you can possibly be. Those are systems that are built into our reptilian brain that have been there for thousands and thousands of years. We're screwing them up by giving artificial light to our eyes, right? With the lights that come off of our devices is blue light. Our brain essentially interprets it as sun rays. So when the brain gets the message that it's the beginning of the day, the rays from the sun are at their brightest, well, I should start pumping out the cortisol, and that means I should focus and I should be ready to go. We want our brain to get the exact opposite message at the end of the day. So really thinking about the environment that you put around you as you are going to sleep is really important. Treat any underlying medical conditions. There's a lot of things that get worse when we actually lay back down. So I'm thinking of things like reflux, heartburn, congestive heart failure, even things like arthritis, aches and pains can interrupt sleep. If your kidneys aren't working that great, you're up and down to the bathroom, and anxiety. So make sure you're working with your doctor, identify any medical issues. If after doing all this, you still come up with crappy sleep, then I want you to insist to advocate for a sleep study. A sleep study is one night out of your life where you go into a doctor's office that's meant to look like a hotel room. They hook you up to all these monitors. It's not super enjoyable, but it's really for your benefit. That way you have a good assessment. The very first rule in the stroke recovery guide, which applies to truly anyone with brain injury, is to make your map. If you don't have good assessments of a problem, you don't even know where to start with the solution, right? You have to get so specific on what's causing the problem before you're going to know exactly what should be done about it. One of the recommendations that can come from a sleep study is a CPAP machine. And this is basically a breathing machine that puts oxygen directly in through your nose, into your body, and in your brain. People who use CPAP for at least 4 hours a night get huge. In fact, one of my predictions for the future of brain health care is that many people will be prescribed a CPAP after a stroke or a brain injury. Right now it's reserved for sleep apnea, where people actually have these pauses in their breathing and their oxygen levels plummet. But it makes so much sense that optimal oxygenation after any kind of a brain injury is going to be helpful, that many of us are thinking that that's really in the future of helping people manage brain injuries. So there's so many benefits. So I said before, you're going to have to advocate for some help with sleep. In the very short amount of time that we have with our medical providers nowadays, sometimes we don't get to the things they can't see, right? If you've been following me when I talk about stroke, you know one of the things that is bothersome to me is that the physical symptoms of stroke take up all the focus. And that is the most important thing for some of you, but there's also many of you who have symptoms that can't be seen. Cognitive issues, sensory issues, vision issues, emotional issues, social issues, financial issues, intimacy issues. The list goes on and on. And the doctor isn't necessarily going to have the time or the knowledge or the sensitivity to approach you those things. So if you want them to get better, you're going to have to be the one that learns to be comfortable with advocating for yourself. So we think that only about 6% of stroke survivors are offered a sleep study. Only 2% of them actually complete it. That's pretty concerning to me. And in TBI, I couldn't actually find any research on that. But what I know is that 60% of people after a TBI say that they have long-term sleep issues, okay? So if you've listened to my lecture tonight, what you now know is that that is alarming and you don't want that to be you, okay? The research-based recommendations to improve sleep after a stroke are a brief trial of a prescription medication. So before I did say I don't want you doing that long-term if it can be helped, but the truth is sometimes our sleep cycle, the circadian rhythm is so out of whack that we do just need to do 1 to 2 weeks of a sleep medication, the lowest dose possible, to just get us back on track. Low dose melatonin, ideally 3 milligrams or less, is totally safe in my opinion, totally fine. White noise, that's something a lot of us rely on. Sometimes you just don't think about how much that might be able to help you. So just a fan or a aromatherapy machine, or even on YouTube, there's 10-hour videos just of white noise. Bright light therapy has been shown to help people. So we think of that as commonly treating people with seasonal affective disorder. And what that is in the winter months when there's less sunlight, some people get really blah and depressed, but it can also help reset the sleep cycle and the circadian rhythm. They're about $40 on Amazon. So the idea is you put it on when you have your morning coffee or your breakfast, 10-15 minutes a day, and it helps simulate that strong rays of the sun so you can get back on a normal schedule. The busier you are during the day, the better you're going to sleep at night. So trying to increase your activity as much as you can. Those are very important. Finally, what I want to share with you is the importance of that calming of the nervous system. There's no reason in this day and age, if you're watching me on Facebook, then you have access to YouTube, right? There are literally thousands of free videos on there for helping with sleep, meditating, guided visualization, deep breathing. You have to find what works for you, but the goal is to calm, right? We have to set the stage for sleep. We can't demand that it comes through that door. We have to welcome it in through the door. So a bath, music, reading, anything that we can do that will help to calm our stimulation. So if you enjoyed this information, if you thought that it was helpful, if you want to see more of this kind of thing, please help us spread the word. We are really putting our heads together over here to think about what we want to do in the next few months. And I think no matter which way we take our I Care for Your Brain program, the more people we have out there liking us and following us and sharing us, the more power we're going to have to be able to get supporters and people that are going to let us bring our message to as many of you as possible for free. So even just liking, clicking, sharing, those things actually really help us in our mission. I will be back again next week, and what I'm going to talk about is the #1 risk factor in midlife for less than optimal brain health as you get older. So what is the one thing you can do in your 40s and your 50s to put some protection in the bank against your brain in your 70s, 80s, and 90s? I wonder if you guys can speculate what that might be. So I will see you again. Thank you guys so much for being here, and I will see you next time. Thank you. Bye-bye.